Hello everyone, and today we are going to do the integrative physiology. Okay, integrative physiology often we ignore and don't read, but you can get some questions on your integrative physiology, like the effect of physiology of stress. Okay, what happens due to meditation, yoga, how the body temperature is regulated, what is the mechanism of fever, cold injuries, heat stroke. Okay, uh, how what is the effect of the obesity, starvation. Okay, inactivity, physical activity, what is the physiology. Okay, what is aging, what are free radicals, and how they're used in different production of toxins and all. Okay, then response to extreme heat or response to extreme cold, body temperature regulation, etc. Integrative physiology, miscellaneous topics are there. Okay, and according to a CBME curriculum, the integrative physiology has been important. Okay, so it is like it disturb ultimately what happens, it is a disturbed physiology. Okay, we are trying to correct our patients by medicines or the corrective studies, but integrated approach combines the holistic approach. Okay, it has the holistic approach. Okay, so to treat patients, okay, we need to apply the holistic approach to treat patients. Okay, we can't prescribe a long list of medicines to so as to treat the patients. Okay, we have what we have to do, we have to advise them to do yoga, we have to advise them to do meditation. Okay, and look at what best, what without medicine what we can do. Okay, so as to minimize the side effects and their cost effectiveness also. Okay, and more importantly, as you are a doctor, so you have to enforce healthy lifestyles also. Okay, good health. Okay, so first of all, let's see what is stress. Okay, what is stress? Stress is any physical or psychological conditions. Okay, any physiological or psychological conditions. Okay, in which the body which tries to disturb the normal homeostasis of the body. Okay, this any physical or a physical condition, physiological condition. Okay, it tries to disturbs the homeostasis of the body. Okay, disturbs the homeostasis of the body, and the body tries to correct it. Okay, in acute stress. Okay, in acute stress, stress may be acute or it may be chronic stress. Okay, acute or chronic. So in acute stress, the body responds by stimulation of the sympathetic nervous system. Sympathetic nervous system is stimulated. Okay, in which it generates the fight or flight response. Okay, in chronic stress, a hormone plays which is called as the cortisol. Cortisol is also called as a stress hormone. Okay, stress hormone, and it is also called as a life-saving hormone. Okay, understood. After this, first of all, for stress management. Okay, there are few terms related with it. Okay, one is called as allostasis. What is allostasis? Allostasis is the process by which body adapts the stress. Process by which body adapts the stress. Process by which body adapts to stress. Okay, and another another term is called as a allostatic load. So what is allostatic load? Allostatic load, if the stress is persistent, okay, and becomes the chronic stress, then the body mechanisms, okay, fail. Okay, the body mechanisms fail. It generates a load. Okay, it generates a pressure to clear the stress, which will cause allostatic load. Okay, if mechanisms to reduce stress fail, so allostatic load is generated. Okay, and the chronic allostatic load will cause alteration in the HPA axis Okay, this will cause alterations. This will cause alteration in HPA axis, or hypothalamo pituitary axis, HPA axis. Okay, and it leads to disease stress. Okay, it leads to diseases. Okay, so stress will predispose a person. Okay, stress will predispose a person, predisposition to various risk factors like your obesity, your anxiety, depression, and your silent pandemics, which are diabetes mellitus and your hypertension. Okay, this diabetes mellitus and your hypertension, these are called as silent pandemics, and this can be easily treated by lifestyle modifications only. Okay, these are lifestyle disorders. Diabetes mellitus and your hypertension are also called as your lifestyle disorders. Okay, so this is allostasis and allostatic load. Okay, so how does body respond to stress? Okay, how does body respond to stress? So the body can do adaptations. Okay, how body responds to stress? So it can do adaptation. What are adaptations about? There are some changes that acquire in the body to deal with stress. Adaptations may be your physiological adaptations or behavioral adaptations. Physiological adaptations, like what may be there? Increased BP, tachycardia, lipolysis, gluconeogenesis, okay, etc. And behavioral adaptations like suppression of hunger suppression, okay, your alertness, this all. Okay, so what are the stages of response to stress? Stages of stress response. Okay, what are the stages of stress response? So we have 3 stages of stress response. One is your alarm stage, in which the person becomes aware, that person feels threatened. Okay, the person is threatened. Okay, then the next one is a resistance stage, in which the body of the person, okay, by activation of different mechanisms, try to deal with stress, okay. And the third stage, alarm, resistance, and exhaustion stage. Okay, if the body is able to deal, then there are only 2 stages. But if the body is not able to deal, okay, all the mechanisms fail, the body functions get disturbed. Okay, so all mechanisms fail. Okay, then the body can't deal with stress, and this leads to disease states. Okay, what are the signs and symptoms of stress? Okay, what are the signs and symptoms of stress? So we can have cognitive symptoms, we can have emotional symptoms, physical symptoms, okay, and behavioral symptoms Okay, so cognitive symptoms. What are the cognitive symptoms? This include the memory problems. Okay, your concentration loss, anxiety. Okay, Like, think of an exam. You are stressed about an exam. So this you read, but you don't tend to remember. Memory problems may occur. Your concentration loss is there. Anxiety will be there. Emotionally, you will be undisturbed. Disturbed, like you're unhappy. You will be unhappy. Okay, and you will feel loneliness. Okay, mood problems, mood swings. Okay, and mood disturbed. And physical symptoms, this will include fatigue. Okay, fatigue and body pain. Fatigue, your body pain will occur. Okay, periods will be irregular. Irregular menses. All this. Behavioral symptoms like sleep problems, sleep disorders, insomnia, addictions. Okay, the person get addicted to different addictive substances and all. Okay, due to stress only. Okay. Okay, so what are the effects of stress on body? Okay, there's the signs and symptoms of stress. What are the effects? Effects on body? Okay, what are the effects of stress on body? Okay, let's talk about effects on endocrine system. The stress will induce acute and it will disturb the HPA axis. Okay, in CNS, the amygdala. Okay, the due to the stress, there will be decreased neuronal plasticity, memory impairments, anxiety and depression. Okay, due to immune system, the immune protection will decrease, and the person will be susceptible to infections. Okay, and the metabolic changes like visceral fat will increase, heart diseases and other cardio metabolic disorders will also be there. Okay, so stress can cause long term as well as short term effects. Okay, it can affect many that problems. It can cause many problems in the future. Okay, so the role of yoga and relaxation techniques are important in stress. Okay, if we define health as a complete, we do not talk only about body, but we also talk how our body, mind and the soul work together in a harmony to maintain the health. Okay, so psychology can maintain then affect the physical parameters in the body. Okay, so for that, the yoga and all relaxation techniques, different asanas have good effect on the body. Okay, they have physical benefits and mental benefits also, which are very important, because health is defined as a complete state of physical, mental and social well-being, and not merely the absence of disease or infirmity. Okay, so the mental well-being is also incorporated within the health, so mental aspects are important. Okay, so what are the benefits of yoga? What are the benefits of yoga? So for benefits of yoga, first let us talk about effects on ANS. Okay, the asanas act by ANS. Okay, they improve the mental well-being by increasing the parasympathetic system dominance over sympathetic. Okay, so increase parasympathetic dominance. Okay, and this parasympathetic dominance will decrease the heart rate, decrease the BP, and bring down the body to a calm state. Okay, this will bring the body into a calm state. Understood? After that, what are the effect of respiratory system? Respiratory system. On the respiratory system, due to reduced sympathetic dominance and increased parasympathetic dominance, okay, there is reduced minute ventilation. This is called minute ventilation. Minute ventilation is reduced. Okay, and there is reduced respiratory response to CO2 and reduced respiratory rate. Okay, and the cardiorespiratory endurance is increased. It is beneficial in asthmatic conditions and obstructive lung diseases. Okay, so yoga are mainly prescribed in asthmatic patients also. Okay, and on your muscular system, This increase the muscle efficiency, increase muscle efficiency. Okay, and the increase the aerobic power of muscles, aerobic power of muscles. Okay, aerobic power is increased by converting the fast twitch fibers are converted into slow twitch fibers. Fast twitch fibers are converted into slow twitch fibers. Okay, what is the effect on EEG? EEG. Okay, this helps to increase the alpha activity on EEG. Increase alpha activity. Increase the alpha activity in EEG. In EEG. Okay, alpha activity. The alpha waves are increased in the EEG. You must have learned about waves in EEG. Alpha, beta. Okay, and the theta waves, the K waves. Okay, the long K waves which we can see during sleeping and all. Okay, and the meditation is also used to enhance cognitive processing in brain. Okay, which helps to improve the concentration, attention, memory, and the mood of a person. Okay, then yoga has a role in the diabetes control also, diabetic and other disorders. Okay, so it decreases the fasting blood sugar decreased. Okay, and improves the HbA1c, improves HbA1c, which is the average concentration, average blood sugar concentration in 3 to 8 weeks. Okay, it lowers the cholesterol, it lowers the LDL and VLDL, lowers the LDL and lowers the VLDL. Okay, so it is a very important, it has a very important role to play in a metabolic disorders. Okay, and it has also effects on obesity. So yoga, when yoga techniques and relaxation techniques are practiced for long term, not in short term, doesn't work in a short term process. You need to persistently do on these activities. Okay, this help in the reducing the BMI of the person. This help in the reducing the BMI of the person. So BMI of the person is reduced. Okay, let's talk about the body temperature regulation, about the mechanism of fever and cold injuries, and about heat strokes and all. Okay, so let's talk about body temperature regulation. Okay, let's talk about body temperature regulation. Talking about body temperature regulation. Okay, when a person exercises, there is a release of heat due to increase in metabolism. Okay, this causes increase in body temperature. Okay, as it can raise up to about 40 degrees Celsius. Okay, so when a person exercises, there is a release of heat due to increased metabolism, and this release of heat can even exceed more than 40 degrees Celsius. Okay, this can even exceed 40 degrees Celsius. Okay, if a lot of heat is released with exercises, then the body temperature may rise less than normal. Okay, may rise more than normal. Okay, so to get it back, okay, so that the body temperature is decreased, the body tries to increase the cutaneous blood flow. Okay, the body tries to increase the cutaneous blood flow. Okay, so this release of heat, what it can do, this release of heat can cause excessive body temperature, this increased body temperature. To get it back, to reduce again, to decrease again. Okay, body tries mechanisms such as your increased body increases your cutaneous blood flow, body increases cutaneous blood flow, which is by vasodilation, via vasodilation. Okay, via vasodilation, understood. And also we practice evaporative coolness by sweating. Okay, so there is increased sweating in when you do exercise in the gym. Okay, so body's thermoregulatory mechanisms, how much thermoregulation has to be done, okay, and depends upon the exercise type, the duration, as well as the intensity. Okay, what happens when the person sweats is that when there is when a person is sweating, okay, there is a loss of salt from the body. Okay, so there are chances that the person may lose salt. Okay, the person may lose salt with evaporative coolness. Okay, the person may lose salt along with the body water. Okay, so a person may faint if a person stands in the sun for a long time. He or she may faint due to the loss of salt and electrolytes also, due to the loss of salt and electrolytes also. Okay, and this is also an important fact, that if a person sweating may cause loss of salts and electrolytes along with water, along with water. Okay, so a person may faint, he may faint if he stands for long hours, in sun. Okay, so a person can faint. Okay, then about fever is term as a pyrexia. Okay, fever is also called as a pyrexia. Okay, pyrexia means fever. Interleukin 1 causes fever. Okay, IL-1, interleukin 1, this causes fever. Okay, so interleukin 1, what it does, it stimulates the formation of prostaglandins. Okay, stimulate the formation of prostaglandins. Okay, which act on hypothalamus. This prostaglandins will stimulate the thalamus and can cause the fever. Okay, so IL-1 can cause fever. Okay, so your antipyretic drug, your aspirin, which is an antipyretic, what it does, it decreases prostaglandins. Okay, and reducing of fever. Understood? So after that, let's discuss about the physiology of energy balance, body weight, and starvation, and obesity. Okay, so here, what is the relationship? Let's talk about the relationship between the body weight and energy balance. Okay, all the food we eat is a source of energy. Okay, let's talk about body weight and energy balance. Let's talk about energy balance as a whole. Let's talk about energy balance. So talking about energy balance, the food we eat is a source of energy. Okay, food we eat is the source of energy for the body. Okay, it is utilized in each and every cell. Okay, the food is utilized in each and every cell so as to maintain the proper functioning. Okay, to maintain the constant body weight also, we should be able to carry out equal amount of energy expenditure, so that energy balance must be maintained. Okay, if the food energy intake exceeds expenditure, okay, it can shift the body weight to higher side, it can lead to obesity. Okay, if the intake exceeds the expenditure, it can cause obesity. In a person. Okay, and hypothalamus plays an important role in maintaining the body weight and energy balance. Okay, let's talk about what is BMR, the basal metabolic rate. The basal metabolic rate is the rate at which body expend the energy per unit time. Okay, So it is expressed as the rate of heat production. Okay, rate of heat production in kilocalories per hour. It is called rate of heat production in kilocalories per hour. Okay, in kilocalories per hour. Understood? Yeah, and it depends upon the food intake, the physical activity, and many other factors. Like energy expenditure will increase if you do physical exercise like swimming, cycling, running, jogging, etc. Okay. Then how is food intake regulated? Okay, food intake regulation. How is food intake regulated? So how is food intake regulated? If you are hungry, okay, if you are hungry, normally the food intake is regulated, okay, by the hunger and satiety center in hypothalamus. So you have a hunger center and you have a satiety center. These both centers are present in the hypothalamus. Okay, hypothalamus, and this will help to regulate the food intake. Okay, so hunger center, what it does, if you are hungry, decreased nutrients will be there. Okay, decreased nutrients, and ghrelin will be produced. Ghrelin is the hunger producing hormone. Okay, what it does, that this both will stimulate the neuropeptide Y. Okay, this will stimulate the neuropeptide Y, and due to the stimulation of neuropeptide Y, okay, it acts via orexins. Substances called as orexins. Okay, orexins, and what it does, it stimulates appetite, and the person eats food. Okay, so the neuropeptide Y, it is the appetite stimulator. We have a appetite suppressor also, which is present in the melanocortins. So melanocortins are your appetite suppressors. Okay, appetite suppressors are melanocortins. Understood? And the appetite stimulator, neuropeptide Y, is the appetite stimulator. Understood? So by this your food intake is regulated. Okay, so arcuate, this just an important fact, that is neuropeptide Y and this melanocortins both are produced by your arcuate nucleus of hypothalamus. The both are produced by the arcuate nucleus of your hypothalamus. Okay, melanocortin, for example, your alpha MSH will there. Okay, these are appetite inhibitors. Okay, so okay, this is the fact. Understood? What are the various factors that can influence the food intake? Okay, many factors can stimulate or suppress the food intake. Okay, how much food you take and how much you don't. Okay, various factors will decide the food intake. Okay, so factors deciding food intake will be decided by many factors like social customs. Okay, social customs, this may increase or decrease your food intake. The mental status of the person, this will increase or decrease the food intake. Okay, availability of food, if there's more availability, the person will tend to eat more. Okay, availability of food, this will also increase or decrease the food. Melanocortin stimulation, like your alpha MSH inhibits food intake. Okay, your CCK and leptin This also inhibit food intake. Body fat, if there is increase in body fat, increased body fat, this will also inhibit your food intake. And satiety center stimulation inhibit food intake. Satiety center stimulation will also inhibit decrease the food intake. Okay, these are factors decreasing food intake. Okay, what is the role of adipocytes in health and diseases? Okay, adipocytes. So adipocytes adipocytes have active role in energy homeostasis. Okay, so adipocytes have an important role in energy homeostasis. Okay, important role in that energy homeostasis. Okay, and leptin also. Leptin, the hormone secreted by adipocytes is leptin. Okay, leptin has an important role in your balance, energy balance. Okay, and it also regulates. Why it is important in energy homeostasis? Because it releases various factors like leptins. Releases leptins. Okay, it releases your tumor necrotic factors. Okay, and IL-6. Okay, this is all. Okay, and this usually help in your energy homeostasis. What is the effect of leptin? Okay, what are the actions of leptin? So you have normal adipose tissue. Okay, if there is excess of adipose tissue, or excess fat, okay, then there will be increased leptin levels. Okay, and increased leptin levels, okay, will cause leptin resistance. What is the function of leptins? Is that the leptins, okay, if the levels are normal, then they will increase the appetite suppression. Okay, they'll increase the appetite suppression, means the person the food intake is reduced. Okay, if the leptin levels are normal, okay, then it will inhibit the appetite. Okay, the person will tend to eat more and more, and activate the appetite suppression, and increase the insulin secretion. So this, due to leptin resistance, this all functions are reversed. Due to reversal of function, the appetite is activated, and the person will be completed. He will feel complete after a meal. Okay, he will not tend to eat more. Okay, so the all function, the person eats less. Okay, the person starts eating less. Understood? The person starts eating less. Okay, so this is alteration leptin. This is action. Okay, and lack of exercise, availability of energy dense food, stress, some disorders. Okay, less sleep. Okay, this all affect your leptin functioning. Okay, body fat is located. Okay, let's talk about obesity first. If the body fat is located around organs, okay, periorbital fat, okay, like your fat in the mammary glands, okay, this deposition or visceral fat deposition affects the health. Then your subcutaneous fat deposition. Okay, so obesity due to excess of body fat, many health hazards may cause, like a metabolic syndrome may lead to diabetes mellitus. Diabetes may lead to nephropathy. Okay, and it may lead to chronic renal failure. Okay, and due to diabetes, eye diseases are common. Eye disease, okay, your neuropathy, all the health hazards, your heart, chronic heart disease, chronic heart disease. Okay, then it will cause obesity will cause non-alcoholic fatty liver. Okay, non-alcoholic fatty liver. Okay, which will lead to cirrhosis, liver cirrhosis. Okay, obesity will also cause arthritis and sleep apnea. Okay, many health hazards are there. Okay, then arteriosclerosis, atherosclerosis, many are there. Okay, understood. Another thing related with your given with your energy homeostasis or the food balance is your anorexia nervosa, a disorder called as your anorexia nervosa. This is a disorder in which there is suppression of appetite. Okay, suppression of appetite. So this is occurring in adolescent girls having fear of gaining weight. Okay, in adolescent girls having fear of weight gaining. Your food means in this disorder the people they don't eat. Okay, due to its brain malfunction or due to its malnutrition, we don't properly know the cause, but the girls don't eat food due to the fear of gaining weight. Okay, this is called as anorexia nervosa, and just remember this. Then another thing is starvation. What is starvation? Starvation is if food intake is chronically less. Okay, so in starvation, first of all, what happens in starvation is that starvation. Let's talk about a little bit of starvation. Okay, initially in few days, okay, in the first few days of starvation, in the first few days, what happens is that body stores in from glycogen are utilized. Okay, and glucose is made available to brain by gluconeogenesis occur. Glycogen is utilized, glycogen stores are utilized. Okay, glycogen stores by body, and in brain glucose is utilized. Brain is given glucose to utilize. Okay, in first few days. Later on, as more months later, what happens? Okay, later on what happens, as the stores are depleted, the brain will start using ketone bodies as fuel in chronic starvation. Okay, in chronic starvation, the brain starts using ketone body as fuel. Understood? So this is the thing. Okay, you know the normal metabolism and nutrient pool in our body. Okay, carbohydrates are main storage fuel. Okay, and which are in the body and brain metabolism. Okay, excess glucose is stored as your glycogen stores. Okay, and if there is more and more beyond the capacity of glycogen, then it is converted by lipogenesis. Okay, proteins are used as amino acids, excess protein remain in amino acid pool, and etc. Okay, then we have two type of states. We have a fed state and a fast state. Okay, in which we are given more and more food, and fed state where eating sufficient food, our body has stored of sufficient food. Okay, and we have a fast state. Okay, in the fed state, what happens, we have sufficient food, so it will promote the glycogenesis and lipogenesis. Okay, glycogenesis will occur will occur, and lipogenesis will occur, because we have glucose sufficient, okay. And in fast state, it promotes glycogenolysis to make glucose, okay. There is decreased glucose, so we have to do glycogenolysis in the fast state. This will occur, okay. And there will be gluconeogenesis, okay. And there will be beta oxidation too, gluconeogenesis and beta oxidation, okay. Understood? Okay, so let's define the physiology of physical activity and inactivity, okay. What is movement is any musculoskeletal activity in the system, okay. Physical activity involves body movements or limb movements, okay. But exercise is a planned, okay. Exercise is a planned structured body movement, which is aimed at maintaining or improving physical fitness, maintaining and improving physical fitness, okay. Understood? Why is there is increased physical inactivity in today's lifestyle is that human body is evolved in that way. We have adapted the fuel metabolism in such way that any type of energy imbalance, either positive or negative, makes the human susceptible to disease, okay. Food is available, and they are the famine, and physical activity no longer the part of your routine, okay. Like we have feasts, and we are just enjoying our lives, okay. We don't have any problems now, okay. Physical activity, people are just getting lost in the social media and mobiles phones, and your Instagram and Facebook and all, okay. So in mobile video games, gaming has been improved. There's improvement in the communication sectors, in the telecommunication sectors, okay. So people are getting the comforts, okay. I've read a book back in times, which was called as a death by comfort, okay. Death by Comfort is a book, okay, which I have today also, which I sometimes read. This was by Paul Taylor, okay. Death by Comfort, Paul Taylor, okay. This is a self-help book, basically. So he is a doctor by a profession, and he tells about that the how the comforts of the life are killing our youth, or killing our body, okay. What are the benefits? Benefits of physical activities, that there is this decreased risk, okay. What are the benefits? So the decreased risk of your hypertension, decreased risk of your hypertension, and diabetes mellitus, okay. Strokes, okay. It increases the muscle mass increase, okay. And increase the strength, increase the flexibility, okay. In endocrine system, it decreases the insulin requirement, decrease insulin requirement, okay. Then happiness, you will feel happiness on doing exercises and all, okay. Decreased stress, cortisol synthesis, decreased cortisol is the stress hormone, so it will decrease the cortisol levels, okay. Then increase the slow wave sleep, okay. Increase sleep quality, many things, okay. Then we have cardiometabolic effects, like it will decrease the triglyceride, okay. Decrease the LDL and VLDL, okay. it will increase the HDL concentration, okay, and decrease the systolic blood pressure, SBP. This is the systolic blood pressure, okay. Okay, so these are the importance of your exercise. What are the different types of physical exercises? So we have mainly four different type of physical exercises. Exercises are basically four types. We have aerobic exercises. Aerobic is divided into light aerobic exercises, like all our activities we do at our leisure time, daily course, okay. Then moderate aerobic exercises, moderate, like okay, like walking or jogging and all, okay. Then vigorous exercises, vigorous exercises make your heart, lung and the muscles work very hard, okay, like you are gymming, okay. This is aerobic exercise. Then we have muscle strengthening exercises. Then you have muscle strengthening exercises, okay, like your sit-ups, your push-ups and all your gym exercises. Then you have stretching exercises. Then you have stretching exercises like a yoga and all exercises for flexibility, okay. Then you have neuromuscular exercises, okay, neuromuscular exercises. This is useful for maintaining balance and your proprioception. Okay, then we have the WHO guidelines, okay. WHO guidelines for exercise, for physical exercise. We stay in Asia, so for Asians, WHO has prescribed that all adults must must do moderate physical exercise, moderate exercise for about 40 to 60 minutes, okay, which must include your aerobic plus your muscle strengthening exercises, okay. And children less than 18 years, okay, this they must be involved in 60 minutes of physical activity daily with moderate and vigorous exercises, okay. And children should have 10 to 13 hours of adequate sleep. Children should have 10 to 13 hours of sleep, okay, 10 to 13 hours of sleep. And the adults must have 6 to 8 hours of sleep per day, okay, 6 to 8 hours of sleep per day, okay. These are the WHO guidelines, okay. And sedentary screen time, okay, this should be restricted for different age groups, okay. The screen time must be decreased, understood. And specific exercises should be for rehabilitation, disease management. Specific exercises are prescribed in the WHO guidelines. You can find from the WHO website and all, okay, if you want to read, okay. If you are not doing physical activity, then there will be increased fat mass, then depression, risk of anxiety, okay, and sleep apnea. Indirectly it will lead to your disturbed homeostasis. It will increase your allostatic load, okay, and stress, alteration in your HPA axis, which will increase your cholesterol, not your cholesterol, cortisol will cause dyslipidemia, insulin resistance and fatty liver, which will lead to metabolic syndrome. And catecholamines will be increased, which will increase your blood pressure and sympathetic activity and cause hypertension, heart disease, strokes. Then immunity will be suppressed, prone to infections. Mental health will be disturbed, okay. If principle of exercise is there, which is called FIT principle, FIIT principle. So what is FIT principle, okay, what is FIT principle? So FIT principle, FIIT, when you prescribe any exercise to a person, Okay, so you have to follow the fit principle. Okay, first one is the number of days. Okay, frequency. Okay, number of days per week. How many number of days the person has to exercise? What is the intensity of exercise? Intensity. Okay, then this is FITT. Sorry. Okay, I just wrote mistakenly TT. T is the length of the time duration for exercising, and the type of exercise. Okay, type of exercise. Okay, then there is the physiology of fetus, newborn, and infancy. The physiology of fetus, newborn, and infancy. Okay, so we'll first read about this. It is also given in that curriculum. So physiology of fetus, newborn, and infancy. Okay, let's discuss it. So we have the neonatal period here. Neonatal period is the period of birth from up to 4 weeks. Okay, up to 4 weeks. This is neonatal period. Then a postnatal period. Postnatal period is up to after. And this is a period after birth. Period after birth. Okay, and then we have infancy. Infancy is the period up to from 1 month to 1 year. Okay, this is your infancy, 1 month to 1 year. Okay, understood? What are the important changes, okay, observed in various physiological parameters from birth? Okay, what are the changes in physiology after birth? Okay, after birth, just after birth. Okay, what are the changes? Okay, so after birth, the normal BP is about 70 to 50 mmHg. Okay, so neonates have less BP. Okay, due to parasympathetic dominance on the myocardium, the heart rate there is advance with the heart rate is increased. Okay, heart rate is more due to sympathetic dominance. Heart rate is more about 100 to 150 beats per minute. Okay, 100 to 150 beats per minute. Okay, with advancing age, the parasympathetic dominance is established and 70 to 90 beats per minute by adulthood will occur. Okay, in newborns, HB levels are high and RBC count is also high due to more active sites for RBC production. Okay, and there is HbF present, which has alpha 2 and gamma 2 subunit. Okay, which has more oxygen affinity. Okay, which will cause the left shift. You know all these things. Okay, there is gradual maturation of renal system. Okay, the due to high vascularization, GFR and renal blood flow are also low. Okay, in that newborns. Okay, GFR is low and renal blood flow is also low. Okay, then about immunity, your maternal levels of IgG, maternal antibodies are protecting it. Okay, so maternal antibodies, okay, these are protecting the newborns, protect newborn. Okay, understood? Afterwards, about the liver function. Okay, sometimes we may observe that there are neonatal jaundice cases. Okay, this is the most commonly encountered neonatal jaundice cases, which is called as your physiological jaundice. Okay, physiological jaundice. Okay, physiological jaundice is an important change after birth. Okay, these are these occur within the first few days of life. Okay, and this is just normal thing. Okay, physiological jaundice, neonatal jaundice. Okay, And the total body water is also more. Okay, in infants the total body water is more. Okay, and in CNS myelination haven't been it will just start. Okay, it hasn't been occurred. Okay, so in blood brain barrier, the blood brain barrier is poorly developed, is poor developed. Okay, it's poor developed. The blood brain barrier is not much developed. Okay, and the body temperature, the newborns are you're susceptible to hypothermia. Okay, neonates with the help of non-shivering thermogenesis deal with the hypothermia. They may suffer from hypothermia. And this is due to brown fat present in them. In the adipose tissue, brown fat globules present. Okay, and they deal with this via non-shivering thermogenesis. Okay, understood. And this premature infants are also susceptible to NRDS. What is NRDS? The neonatal respiratory distress syndrome. Okay, the neonatal respiratory distress syndrome, NRDS. Okay, and the surfactant production starts at about 32 weeks of gestation. Okay, what are the factors required for normal growth? Okay, the hormones are required: growth hormone, insulin, sex hormone, liver, insulin growth factors are required, adequate protein, vitamin, mineral are required. Okay, then many developments, behavioral and psychological developments are required. Okay, so these are the things which are required for the neonatal growth. Okay, so after the neonates, after the changes, the physiology of the neonates, let's discuss the physiology of aging. Okay, let's discuss the physiology of aging. Okay, so what is the physiology of aging? Aging is a universal dynamic process. It is a universal process. It is not possible that you won't age. Okay, it is a dynamic process. In time related deterioration. Okay, the functions of the body start deteriorating. Okay, and the timing at which aging starts may vary on depend upon the factors. Okay, aging may of two types. One is the primary aging. Okay, another type is called as a secondary aging. Okay, primary aging and secondary aging. Primary aging, it is a normal aging process. It depends upon the hereditary patterns and age. Okay, depend on your age and genetics. Okay, depend on age and genetics. Secondary aging is affected by various factors, affected by other factors. And what other factors will affect this? Like your education, your customs. Okay, education, your customs. Okay, your diet, your physical activity, then your physical activity. This all. Okay, what are the different changes? At aging? Okay, this is important. Changes at aging. Okay, what are the changes occurring at the aging? So skeletal system, what will it occur? Okay, decreased bone density. Okay, bone loses calcium. Okay, muscular atrophy, muscles start degenerating. Okay, and there will be increased fibrous tissue. Okay, early fatigue. Okay, this all will occur in the skeletal system. Okay, then we'll see in CVS atherosclerosis. Okay, Then the heart wall thickens, it thickens, and the pumping ability decreases. The pumping ability of heart, it decreases. Okay. And on CNS, the number of neurons, number decreases. Okay. Memory, your concentration, okay, this also decrease. Memory and concentration decrease. Okay, you will see Parkinson's disease occurring in this aged persons. Okay. Then special senses, you may see the development of cataract. Okay. And nerve deafness. Okay. Sensory neural deafness. And all. Okay. Then in respiratory system, you will see loss of elasticity of lungs, loss of elasticity of your lungs. Okay. Loss of elasticity of lungs. And respiratory centers, they decrease the sensitivity. Okay. Sensitivity of respiratory centers are decreased. Okay. The GI motility is decreased. Decreased GI motility will occur. Okay. Decreased digestion and absorption. Okay. Indigestion will occur. And in kidney there will be decreased nephron number. Okay. Decreased number of nephrons, decreased GFR. Okay. Then on endocrine system, there will be decreased number of receptors. Okay. And decreased hormonal actions. Okay. On immunity, cancers are common. Okay. Cancers are common in reproductive systems, okay, in reproductive system there will be changes in the reproductive system. Okay. And there will be libido loss of libido is lost, the sexual desire is lost. Okay. There will be decreased sperm production. Okay. And menstrual cycle ceases. Okay. Menopause will occur. Okay. And in sleep also, and there will be decreased sleep requirement and sleep disturbances will occur. Okay. Then what is the relation of free radicals in aging? Okay. Free radicals, they are just reactive oxygen species and reactive nitrogen species. Like example, ROS, reactive oxygen species, and reactive nitrogen species. What they do, free radicals are capable of doing damage at cellular levels, affecting the DNA of cell. Okay. This causes more free the sedentary lifestyle. Okay. Okay. And excess intake of more food intake, and your sedentary lifestyle, combined with your sedentary lifestyle. Okay. This will cause increased production of free radicals, and more amount of oxygen will be required to burn it, and this will cause your aging. Okay. So aging will cause from this. Understood? So what are antioxidants? Your antioxidants are a group of compounds that are capable of deactivating the free radicals. This deactivate the free radicals formed in the body. For example, your vitamin C, vitamin E, vitamin A. Okay, these are antioxidants. There are many antioxidants like superoxide dismutase, your catalase, and all. Okay. So how can you delay the aging process? So you can delay the aging process by a healthy lifestyle. Okay, like good diet, physical activity. Okay, you should not consume any tobacco, alcohol, drugs. Okay. And adequate physical activity, adequately sleeping. Okay. Stay away from your addictions. Okay, different type of addictions. Okay. So by this you delay your aging process. Okay, you can delay your aging process. Now let's discuss about the temperature and exercise. Okay, about the physiological responses to exercise and response in extreme heat and cold. Okay, response to extreme heat and cold. So we are talking about cardiorespiratory changes. Cardiorespiratory changes with exercise. Okay, talking about cardiorespiratory changes with exercise. Okay, let's talk about the muscle metabolic systems. Okay, there are three metabolic systems in muscles. Muscle metabolic system. Okay, these are the systems which provide your ATP or your energy to muscles. Okay, so we have three systems. We have, first of all, phosphocreatine creatine system. Phosphocreatine system. Then we have glycogen lactic acid system, and then we have third, your aerobic system. Understood? So phosphocreatine system, this combined amount of cell ATP and phosphocreatine, this can provide the muscle power only up to 8 to 10 seconds. Okay, this can provide energy only up to 8 to 10 seconds. Here in glycogen lactic acid system, the glycogen is converted into a glucose. Okay, it can use for energy. Okay, oxygen is utilized. Later on, if oxygen unavailable, then glycolysis can continue, and this pyruvic acid can, in the absence of O2, can be converted into a lactic acid, and this can provide energy up to 1.3 to 1.6 minutes. Okay, then aerobic system, this can provide energy up to unlimited time, provided that the food stores are constant. Okay, so in all these three systems, energy can be used to reconstitute the ATP. Okay, and but this lactic acid, this causes fatigue. Okay, this causes fatigue also, and accumulation is called as lactic acidosis. Okay, so this lactic acid is will cause your spasms or your lactic acidosis here. Okay, but the aerobic system recovery, this aerobic system, when it gets depleted, okay, it causes oxygen depth and depletion of glycogen stores of muscle. Okay, this aerobic system is important, but it is the aerobic system recovery is accomplished. Okay, if it gets depleted, it causes oxygen depth. Okay, it will cause oxygen depth in body. Okay, it will cause oxygen depth in body and deplete the glycogen stores. Okay, what is oxygen depth? Let's talk about it. What I am talking about is oxygen depth. Okay, oxygen depth. What is oxygen depth? Normally our body has normally 2 liter oxygen, 2 liter of oxygen stored. Okay, 2 liter of oxygen stored, and this oxygen, 2 liters of oxygen stored, this is utilized in less than 1 minute in heavy exercise. Okay, so this oxygen utilized, it has to be replenished back. Okay, it has to be replenished back. So there will be two types of oxygen. The oxygen has to replenish back, and there is the deficiency of this 2 liter of oxygen. Okay, this 2 liter of oxygen, there is the deficiency, and this is called as oxygen depth. Okay, this is called as your oxygen depth. Okay, understood? Another oxygen depth is, and that includes the body stores of 2 liter and about 9 liters of oxygen for reconstituting the phosphagen glycogen system. This glycogen and phosphagen system, for reconstituting it, we need 9 liters. About 11.2 liters of oxygen depth has to be replenished back. Okay, in our body, around 11.2 liters of oxygen depth is there in the body. Okay, about 11.2 liters. Understood? Okay. And then after so what happens to body heat in exercise? Okay, what happens when a body what happens when a person does exercise in heat? Okay, so there are two cases here. Case number one is person exercises in heat. Okay, person exercises in heat. Heat means more than 38 degree temperature. Okay, more than 38 degrees Celsius temperature. If the person exercises in more than 38 degrees Celsius temperature, okay, then the muscles are seen to be exhausted. Then there is muscle exhaustion. Muscle exhaustion. Okay, then there is muscle exhaustion, and due to this muscle exhaustion, the person can suffer from heat strokes. Okay, means the body heat gain capacity exceeds the heat loss capacity. Okay, and it can also lead to your exertional rhabdomyolysis. Okay, exertional rhabdomyolysis. In this there is the damage to skeletal muscle. Okay, that there is the damage to skeletal muscle. The damage to skeletal muscle, which releases muscle proteins. Okay, this will release your muscle proteins, and this muscle proteins will cause kidney damage. Okay, so what are the effects if the person exercises in heat? So there will be exertional rhabdomyolysis and heat strokes. Okay, then the second case number 2, the person exercises in cold. When the person exercises in cold, what happens is that with exercise a lot of heat is generated. Okay, and the body tries to maintain the normal body temperature, and evaporative heat loss will occur. The heat will be released in the form of sweat. Okay, so it might happen in the cold environment. There's no proper heat loss. Okay, if the person breathes cold air, okay, it is known to increase the airway responsiveness. Okay, the airway is now more responsive to the air that is entering the nasal cavity. Okay, and this airway responsiveness will lodge in different type of particles. Different particles will not be now filtered out of that things. Okay, and it may lead to obstructive lung diseases. Understood? So strenuous exercises can be risky. Okay, for example, in your heart disease patient. Okay, heart disease patients, exercise in your cold climate can lead to your cardiac ischemia. Okay, so this fact is important, cardiac ischemia. So here we complete our integrative physiology. There were just miscellaneous topics. Okay, you know all these topics. Some new terms I told. Okay, and some new concepts. And basically we learned about exercise and what the fit principle, what are the changes, what are the changes of the aging. Okay, and exertional rhabdomyolysis and your cardiac ischemia and your obstructive lung diseases, how they are caused. Okay, and all this. Okay, so just revise these notes, and that's all in today's lecture. Okay, integrative physiology is now over now. Okay, let's meet in any other chapter. Until then, thank you and have a nice day. and do like, share and subscribe. Okay, thank you and have a nice day.